As soon as you're having any of those issues, it's time to go see a pelvic floor therapist. And it's much better to go earlier rather than later. So, things that are not normal are leaking of any kind. You should not be leaking. So, that's leaking with sneezing, coughing, laughing, jumping, exercise, leaking with urgency, so not making it to the bathroom in time. That is a sign that there's something going on with the pelvic floor. So if you're having pain with sitting for a long period of time, with exercise, with intercourse, you shouldn't be having pain with those things.
Hey everyone, welcome to another episode of Hello Hot Flash, where we help you control the midlife change. I'm excited to be here today with Dr. Kalyn Wisniewski. Dr. Kalyn, thank you so much for being on the podcast.
Thank you so much for having me. I'm excited to be here.
Yeah, I'm excited to have you. You guys, Dr. Kalyn and I met at a conference, and I don't know if it was I think it was even before she started speaking. We were just having a side conversation. I'm like, I have to have you on the podcast. The information was so great, and you guys are going to learn so much today. So, Dr. Kalyn is a pelvic floor physical therapist out of Hudson, Ohio, and she specializes in treating both women and men in issues related to pelvic pain and incontinence. And as we age, you guys already know this is unfortunately where we're at right now. So Dr. Kalyn is going to help us out. Once again, thank you so much for being on the show.
Thank you for having me.
Yeah, the listeners are meeting you for the first time. So, beyond the credentials and so forth, what drew you into pelvic floor physical therapy?
Well, I was actually having some issues with my cycles. Um, I then started to listen to podcasts to help fix the problem, solve things, because I wasn't getting the help that I needed from my gynecologist.
Mhm.
So, on one of the podcasts, a pelvic floor PT came on and talked about what she did. And we had talked about like what pelvic PTs did through grad school, but there was not really much else talked about. So then I started to do a little bit more research into it and decided to take some continuing education courses on pelvic floor PT and really fell in love with it. I love helping men and women with this issue. It can be very life-changing to have help with this, and it's very rewarding as a therapist when I can get someone back to doing the things that they love. And that's another reason that kind of got me into pelvic PT. My mother had some significant tearing when she gave birth to us, and that was sort of like in the background of knowing that she had had issues and kind of being terrified as, growing up terrified to have kids because I love being active and I don't want to stop. I didn't want to stop that to have to deal with pelvic floor issues. So that's sort of another reason that I was interested in it, sort of preventatively. Like, how can I not make this my story? So, a few things sort of drew me into pelvic floor PT.
But you were a physical therapist prior, and then you just started to focus on the pelvic floor area.
Yes,
Yeah,
yes. So
yeah.
I did travel PT right out of grad school for a few years before I then decided to specialize in pelvic floor.
Yeah, I love the fact that you brought up the idea around preventative because we don't, especially, we actually, that was part of our conversation about how things are done differently in different countries and how pelvic floor therapy is actually, I think it was Canada or Europe, where they actually offer that as a form of care for women after they have children. It's like automatic. And I'm like, mind blown when I actually heard that. So I love the idea that you brought up preventative because we often don't think of that. We just assume that, once we start to leak, then we need to go. Talk a little bit about that preventative area.
Yes, and I love this side of things. When I can get someone in who is pregnant, that is key. So, um, Getting someone into a pelvic floor physical therapist while they're pregnant can do many things. One, we help them prepare for labor and delivery, teach them perineal massage so that they can have a decreased risk of complications with the delivery process, and set them up to have a better, easier postpartum. Then, typically, I'll set up a follow-up for after that 6-week appointment that they have with the OB so that
Mhm.
we can check everything out, make sure everything is healing well, make sure there's no pain, no incontinence, that they're not dealing with any of these issues. Once we kind of get that established and then we have this relationship, I always tell them, if anything comes up, this is not normal. I kind of lay it out for them, things that they should expect as they age. If, this comes up, if you're leaking, if you have pain, come back in. I already know you. We have a relationship so that this doesn't have to be an issue for you down the road.
Yeah, that is so smart to be able to do that. And for, my audience is primarily 40 to 65, but they have nieces and siblings and daughters-in-law, so that that information can be shared with them. That's super important. And we talk about it, but in all honesty, many of us don't even know what the pelvic floor is or completely understand what it is. Can you explain it so we can better understand what it is?
Yes, definitely. And a lot of people don't understand because it's not a body part that we can visualize very well.
Mhm.
So I like to kind of compare it to the rotator cuff. The rotator cuff is a group of muscles. The pelvic floor is also a group of muscles. There's about 14 different muscles that make up the pelvic floor. I usually bring a model out when I am seeing a client, especially for the first time, to demonstrate where the pelvic floor muscles are. So they are a bowl at the base of your pelvis. So they are a group of muscles that support at the bottom of the pelvis, hold up your organs, control bowel and bladder function. They sort of act as a sling at the base of the pelvis.
Okay. Yeah, that's so good to know. Like again, you did an exercise with us, and we can get through it to it in a little bit here. But when you gave us, I guess you allowed us to visualize or to mentally think about where the pelvic floor was, and we did some exercises and so forth together. So I'm jumping ahead of myself, but that triggered that because that it when you got us to that space, it helped us better understand where the pelvic floor is. So we'll get to that in a minute. We'll get to that in a minute. I want to back up a little bit and just talk about again, many women that are midlife, there's sometimes an assumption that I'm going to have pelvic pain or there's going to be leaking or there's going to be pressure, and it's simply because I'm getting older. Tell us, is this normal? And if not, why?
It is not normal, but it is common.
Mm.
So it happens to a lot of women. And I would say the majority of women that I've treated who are just coming to me with pelvic floor issues are in that like perimenopausal phase where there's changes. Things didn't used to be like this. Why is this happening all of a sudden out of the blue? I never used to leak and now I am. A lot of that is due to hormonal shifts. So we lose that protective estrogen, progesterone, testosterone, all of those hormones are decreasing as we're going through perimenopause. They're shifting, things aren't like they used to be. And now we're losing blood flow to the pelvic floor muscles. We're losing blood flow to those tissues. The blood flow is what keeps the muscles, keeps the tissues healthy. That's what protects us from having these issues with the leaking, with the pelvic pain. So, those changes that we go through with the hormones are really what set us up through that life stage to then all of a sudden have these problems.
Yeah, yeah. So I often, again, we mentioned the leaking and the pain and stuff, but I don't know, perhaps I don't know when it's time to go to the doctor. Maybe, for me, that's probably too much information. I'll give you someone else's scenario. So, the true scenario, though, there's a woman who was actually, it was my gynecologist telling me about another person. She didn't reveal any names, you guys, but she said every time her patient would get in the bathroom and like step on the shower mat, she would leak. Like there was this in her brain, it would automatically cause her to leak. I know someone else that they saw like they can go to any bathroom and be fine, but there's a particular bathroom in their house, they would leak. I'm like, this is so strange. So like that may or may not be normal. What are some other things that should be red flags that this might not be normal? You probably need to go see someone.
Good question. So, and a lot of that's another thing that'll come up too is those urgency triggers out of nowhere. It's like, why all of a sudden am I leaking every time I see the bathroom or get into the shower? That's another thing that is a red flag for people. Definitely should go to see a pelvic floor physical therapist. So,
I didn't
def
realize that was a red flag. I just thought, oh, that's probably kind of normal for some.
Well, it actually it really comes back to quality of life. There
Mhm.
is something we can do to change that. How much do you want to deal with? How much do you want to go through? It's similar to knee pain. If we're having knee pain day to day, someone is going to go to the doctor and get that checked out before they're going to get their pelvic floor checked out.
True, very true.
So, so as soon as you're having any of those issues, it's time to go see a pelvic floor therapist. And it's much better to go earlier rather than later because it will take a lot longer to get you better and to get you to those goals where we want to be if we wait too long. So
Mm.
the earlier the better with everything. So things that are not normal are leaking of any kind. You should not be leaking. So that's leaking with sneezing, coughing, laughing, jumping, exercise, leaking with urgency, so not making it to the bathroom in time. And the same thing with bowels too.
Mm.
So bladder and bowel, both are things that pelvic floor PTs deal with. So that is a sign that there's something going on with the pelvic floor. Another one is pain. So if you're having pain with sitting for a long period of time, with exercise, with intercourse, you shouldn't be having pain with those things. So, having pain of any kind with the pelvic floor, even if it's kind of radiating up into the abdomen, I see that a lot too. So, pain, leaking, frequent UTIs might be a reason to go see a pelvic floor PT because, like I said, those hormones are decreasing in this perimenopausal stage. Those tissues aren't getting the blood flow that they need, and that can be a sign that we're getting issues with the pelvic floor muscles. So, I have a patient who it took her a while to get to pelvic floor PT. She was having UTIs like every other week, so she was going on antibiotics so frequently, which is then internally messing up with her gut. Finally, she went to multiple different doctors. One decided, all right, let's send you to pelvic floor PT. We don't know why you're getting all these UTIs. It wasn't actually UTIs. She was just having pelvic floor pain that was presenting like a UTI.
Oh my gosh. So she's taking the antibiotics for no reason. Oh,
Yes.
wow.
Yeah, so there's lots of things that can be pelvic floor issues, even constipation. I have a lot of patients who have trouble coordinating that push to get the bowel movement out and just learning that coordination that they need to use their core, relax their pelvic floor to get that out can help immensely. Then they don't have to take laxatives and stool softeners.
Yeah. So the UTI coordinate, I would, you automatically go to your gynecologist, or maybe even your primary care. I've learned so much since I started doing this podcast. And so now, that my parents joke like, oh, here comes Dr. Shaw. Because I'm like, well, my last guest said. So no, I never made that correlation and would not have. That's super important
Mhm.
to understand that. And it goes back to what I always stress to people. There's often a root cause that we miss. So your doctor may just see, baseline, this looks like a UTI XYZ, but when you get to the root cause, there's often something else that actually needs to be treated. And this is so important that, again, the alignment with pelvic floor health would have never, ever crossed my mind. This is cool. I like this. I like this. Talk us through a well-rounded pelvic floor strengthening plan. Like, what does that look like beyond, squeezing our muscles together? Because I'm assuming that most people are like I was, before I started talking to folks. Just do a Kegel, like it's what people would say. So talk us through what that looks like, and should we even be doing Kegels?
That is a great question. So, I would say first, have a pelvic floor PT assess things if you're going to start doing a strengthening program. The majority of the patients that I see when they have issues, it's because they have some tension in their pelvic floor, a little or a lot. And if you think about it, any muscle on the body,
Right.
if it is tight, it is not going to activate well. So typically, when you go to physical therapy for your knee, you're going to do stretching and strengthening for a
Yeah.
well-rounded program. So being assessed and making sure that you know exactly what's going on with the pelvic floor is the first step.
Mhm.
So, knowing if you have tension, if you have weakness, and then the second side of that is knowing how to really do a Kegel. I would say about 50% of the people that I get in to my office when I tell them, all right, squeeze your pelvic floor, do a Kegel, completely wrong. They're using the wrong muscles or they're doing a reverse Kegel. So there's a very it's very important to get assessed because it's not like when I say, do a bicep curl. You can watch yourself do that. You get that visual feedback. You're not getting any visual feedback. You're just getting that proprioceptive, that feeling feedback. And if you don't know what it should feel like, then that's a problem. A lot of people are just squeezing their adductors, squeezing their glutes, squeezing their core, and they're not actually tuning into their pelvic floor muscles. So that would be the first step. And then the second part of that is the other muscles that are supporting the pelvic floor. So you've got your pelvis here. Pelvic floor is underneath. If you think about the pelvis, you have the muscles of the core, the back, and then the hips that are supporting the pelvis with a hammock. If you have a hammock and you set it up on two trees that are strong, and you have your pelvic floor down here, your nice hammock, that's going to be supported well.
Right.
If your trees are weak, you're not going to have good support with your pelvic floor. So you want to make sure that the muscles all around the pelvic floor are strong as well. So it's not just doing the Kegels. There's a lot that also goes into it too that affects pelvic floor strength and then obviously the leaking the pain.
Yeah. So we, again, perfect information. And for you guys who are listening on the podcast, you need to make sure that at some point you're checking out the YouTube channel as well, because we're getting some visuals here that I think will be very helpful. Now, again, we've clearly said Kegels may not be for everyone, and sometimes they, may hurt versus help, especially if you're not doing them right. But with that being said, I think one of the best parts of your presentation was when you actually kind of helped us visualize or feel what that was like when you walked us through that. Can you like walk us through what a Kegel may feel like or should feel like?
Yes, yeah. So if we are doing a Kegel, you want to be seated in a supported position, feet kind of flat, equal on the floor. You want to feel your pelvic floor lift up against gravity. You don't want it to come down. That would be more of a reverse Kegel, like a push. So the pelvic floor should move up and away, and you shouldn't be utilizing your glutes, your hips, not too much with your core. You might have a little bit of that, like lower abdominal activating with the pelvic floor, but it should be a very quiet movement.
Mm,
And the cue that I like to use is like you're picking up a blueberry with your pelvic floor. So you're picking it up. It's a very quiet movement. Sometimes I'll have people try this on sitting on like an exercise ball where you
Hmm.
get like a little bit of a stretch, a little bit of that like input from like sitting on the ball,
Yeah.
and then you can feel it move away a little bit easier as well. So the other thing that you can do too is take your hand, sit on your hand, and you should feel your pelvic floor move up and away from your hand. So there's a lot of different ways to kind of feel how you're doing a pelvic floor contraction or a Kegel.
Yeah, I think the one of the coolest parts in that when we were at the conference where some people were like, oh, like
Yeah.
you know what I mean? I don't think I was done this right before. So yeah,
Yep.
that blueberry visualization, maybe it's a little too much, but it's so helpful. It's so helpful because just like you said, so let's say that you were working out your biceps. If you're
Mhm.
doing it wrong, you can hurt yourself, or you can at the least you cannot build the type of muscle that you want. And the same thing I think about when you're doing those pelvic floor exercises as well. Yeah, yeah.
Yeah, yeah, definitely. And I use a lot of different cues because it'll click differently with different
Yes,
people. The
yeah.
blueberry one's a
It
common
did.
one.
It clicked with me too. I'm like, I thought I was doing this right. Maybe I'm doing it right, or maybe I'm not consistently doing it right. But then I actually still think about your blueberry. So it's helpful. It really is. So we just talk about, the Kegels and then maybe how that it would, thinking about how that would impact other physical type of movement. So speaking of that, speaking of exercise like running, weightlifting, Pilates, CrossFit, how does that affect your pelvic floor and how can women stay active without making the symptoms worse? Because just like you said, some movement may cause some leakage in women.
Yep, great question. So, kind of backing up, a lot of my patients who have been, say, active from a young age, so gymnastics, dance, cheerleading, lifting, running, whatever it is, a lot of the times they'll have tension in their pelvic floor. So if you're a person who's been active since you were young, you are definitely likely to have some tension in that pelvic floor. So things like CrossFit, running, things that are going to put a lot of pressure down on the pelvic floor, you can have that reaction with the pelvic floor where it tightens up. So exercise is great, and we know this. There's research behind this. Everyone should be exercising. Women need to be doing those weight-bearing exercises. Exercise is awesome. I'm a huge advocate. I love exercise. It's great for everybody. But if leaking is happening, if pelvic pain is happening, and that's keeping you from exercising, then that's not good. That's not okay. That's not what we want. So, anytime that you have leaking with exercise, pain with exercise, that's definitely time to get checked out by a pelvic floor therapist. And things like CrossFit, where you're jumping or you're lifting heavy, a lot of those athletes are going to be holding their breath while they're doing it. Even in Pilates, I've seen this too. Pilates, yoga, where you're concentrating on what you're doing. You hold your breath, you squeeze your core just like the instructor tells you to do, and then you leak.
Very true, very true. Because they're like, breathe, breathe. And when you breathe, you're like, oh, wait.
Right, right. Oh, yeah, I forgot to breathe. I'm supposed to be doing all these things. So, the breathing piece is huge. So, that's the first thing that I have people look at when they're leaking with exercise is, are you breathing? And a lot of people are not. So, with lifting, with Pilates, things like that, that's the first thing that I'm going to check with them is, are you inhaling and exhaling? If not, you're going to put a lot of pressure down on your pelvic floor, and that's just going to cause you to leak because the pelvic floor can't handle that amount of pressure being put down on it constantly if we're not doing something else like strengthening, stretching to take care of those issues.
Yeah, that's so important to know, especially as we age, because sometimes there may not be that correlation in your mind that
Mhm.
this exercise may be causing this, or you need to strengthen in order to increase in that type of exercise. I found something. I found a whole bunch of stuff when we were in Cleveland together. But one of the folks sitting around, she started talking about a tailbone injury, and you like related. I'm like, what in the world? The pelvic area is like so vital. So, just to back up, one of the folks in the audience mentioned a tailbone industry in injury and said that either she had gone or either you led her to thinking that she needs to go in order to get some type of pelvic floor therapy. So beyond tailbone injuries or other types of injuries, actually let me know what other types of injuries may be related that would cause someone to need to have some type of pelvic floor therapy.
So, kind of on that note, she actually did, since there's no names,
Yeah,
she
yeah.
did come to see me and
Oh,
she
oh,
had full resolution with her pain with the symptoms, which was awesome. So, definitely was a pelvic floor issue. So,
what? That's
mhm.
bananas from a tailbone injury. Yeah, yeah.
Yeah, so and that's the thing, like I've talked to a few patients about tailbone stuff, and who do you go to when you have tailbone pain? Like, where do you get sent? That's not typically like a physical therapy thing. Like, where do you go? So, a lot of doctors don't know where to send their patients when they have tailbone pain. A lot of the times, they'll send them to physical therapy and regular physical therapy. And then, usually, hopefully, if like that physical therapist can't fix it, they'll send them to a pelvic floor PT, which is how I've gotten a number of my tailbone patients. It's like, we can't do anything. We don't know why the tailbone's still painful. And then they come to me and it's usually a pelvic floor issue.
Wow.
So if anyone's having tailbone pain, see a pelvic floor PT. So tailbone pain, that's definitely more of like an obscure one that's a little bit random, but pelvic floor related. The other thing is anytime that there is like an abdominal surgery, you're going to have scar tissue,
Yeah.
and that is going to cause changes in your how your pelvic floor acts with your core and the other muscles. So there are some people who lay down scar tissue like it is their job, and they have really thick scar tissue that then creates a problem down the chain. So, if you think about the pelvic floor, core, back as like a Coke can, you have your diaphragm muscle on top, the core and back kind of around the sides, pelvic floor at the bottom. If you have a dent in that can, that pressurized can, you're going to have issues pressure pushing out in other areas. So I've had a lot of people who have had like abdominal surgeries, C-sections, other things that then cause issues down onto the pelvic floor because that scar tissue is now putting more pressure into the core and that goes down to the pelvic floor.
Mhm.
So, abdominal surgeries is another one. If you have some scar tissue and now maybe you're having a little bit of issues with like pelvic pain, incontinence, it could be the scar tissue through the abdomen causing an issue.
Yeah, that again would have never thought of that. When someone comes to so people may be intimidated by this idea, it's enough to see the gynecologist. We don't need anyone poking around anywhere else. So when someone first comes in for an evaluation, what can they expect?
Yep. So, it's going to be a one-on-one session, so private room. So everything that we talk about, you're not talking about it in front of other people in a gym. It's completely private. So a lot of the first evaluation is going to be asking questions. A lot of the time, people wait too long to see a pelvic floor therapist, and we start unraveling things. And a problem that they've only been having for maybe the past 5 years, and I say only
Mhm,
because
mhm.
that's short for a lot of my patients, Then they start thinking about it, and it's like, oh, no, when I had a baby, I had a tear, and that was painful for a while, but then it went away. And then, oh no, when I was younger, I had an issue with like leaking with exercise, with activity, with what sport I was in. So we start to kind of unpack and unravel all the things, or like constipation. I always ask patients about that because that's something that really affects the pelvic floor. If we're straining, we're putting a lot of pressure on the pelvic floor. And that can be an issue. So I want to get a whole like well-rounded picture of what's going on, what are the symptoms. Someone might be coming in to see me because they are leaking with exercise. Then we find out that they have urgency or that now they have some bowel incontinence. So there's usually more to the story than like just the one thing that they're coming in for.
Yeah.
Um, so then a lot of questions to start off with. Then we get into the assessment, and that is looking at the whole picture. So I want to check your pelvic alignment. I want to look at how your core is functioning, posture, your mobility, flexibility, strength with the back, the core, the hips, kind of all those areas that are supporting the pelvis and the pelvic floor, like I was saying before. And then we do typically do an internal assessment on that first visit. That is going to give me the best, most objective information. That's going to tell me how you're doing a Kegel, if you're able to do that, if you have tension. So, getting to the muscles directly is the best way to really assess that. And that's not the very first thing that we
Right,
do. We
right,
start
right.
with questions, we kind of look at everything else, and then that's sort of the last thing that we're going to check so that we can get an individualized plan. Do you need to do Kegels? Do we need to do some mobility? What actually is going on? Do we need work on coordination? So that'll be sort of the full exam. Once we finish, we'll talk about what's going on. I love to answer questions because
And you're
a
good at
lot
it. You are really
Thank
good
you.
at it. Yeah.
Thank you. A
Well,
lot of people have a lot of questions about pelvic floor because it's not something that we talk about much. It's not something we were taught. So we hear these things on Instagram. We hear these things like from our friends and family members. And a lot of people have a lot of really good questions. And I love to clear up all of the stigma, all of the questions that people have so that they feel comfortable. Because a lot of the times, like if you're going to your doctor, they don't have time to explain everything to you. That's the other thing that I love about physical therapy is I get to see my patients one on one. We get to talking. I usually find out a lot of other things that are maybe not related that actually are really related to their symptoms, like life stressors, different things like that, that are really at the core of why they're having these issues. Stress and anxiety is a huge reason that people have pelvic floor issues. So, getting to know my patients and unraveling that, we actually start to kind of work on that side of things, which I love.
yeah, I like that so much. So this is a question that we had not talked about. What about carbonated drinks or things like kombucha? Does that cause pelvic pain? You're shaking your head like you've heard this before. Have you?
So that's another thing that I will do with my patients is sort of like a bladder diary.
Yeah.
So depending on like what they're eating and their symptoms, we can have these triggers. They're not the same in everybody. And we want to get an idea of that person specifically. So I'll have them keep track of things that they're eating or drinking if they have triggers based off of like, okay, I drink my coffee and then I go to the bathroom every 15 minutes after I drink it.
Mhm.
It's like, okay, maybe we should start thinking about taking the coffee out for a little bit because usually what's happening with like coffee, carbonated beverages, kombuchas, um, even like acidic food, so like pasta sauce, tomatoes, things like that, teas sometimes, that can irritate the lining of the bladder. And then the bladder what happens a lot of the times with urgency is the bladder gets irritated and
Mhm.
can kind of go rogue, and it starts to spasm. The bladder is a muscle and it can get into this muscle spasm, and that's when we feel that urgency, like, oh, I got to go to the bathroom. I'm about to leak. So when we put a bladder irritant in, like coffee, tea, carbonated beverages, fake sugars, that's another big one,
Mhm.
that can irritate that bladder lining. The bladder gets into this like spasmy state, and we're like, oh, we gotta go.
Yeah.
So sometimes it's modification. So maybe taking that out for a little bit, letting the bladder heal, and then slowly reintroducing it to say, okay, how much can I have of this? And just kind of being aware when I have coffee. I'm going to need to go to the bathroom a little bit more frequently in the morning. And that's fine. That's normal. But it shouldn't be like, oh my God, I'm leaking every time I drink coffee. I'm running to the bathroom every 30 minutes. So, with the food side of things, I never want to take away someone's coffee. I love coffee. I drink coffee. It is what it is. But if we can manage those symptoms and get it to more of a normal, then that's what we want. So definitely those things can be bladder irritants, and we work with that, kind of taking things out, bringing things back in so that we can have control of that urgency and not irritate the bladder.
Yeah, I love that so much. Yes, this has been so amazing. I have another question for you. Final question, almost final. If you go back and give your 25-year-old self one piece of advice, what would that be?
Mm, be nicer to yourself. I think that us as women are so hard on ourselves, and it causes a lot more issues
Mhm.
that we put on ourselves, a lot more stress, a lot more anxiety. The reason that I was having cycle issues was because I had an eating disorder.
Oh,
So had I been nicer to myself when I was younger, I wouldn't have had to go through all this like hormonal craziness and having to get my cycles back and having to work on my mental health and my diet and all of that, which I'm glad that I had that experience and I can talk to women going through that, and I have some firsthand knowledge of it. But we are such critics of ourselves, and I truly think that we need to give ourselves a break because we're only human, and we do the best that we can with what we have, and that's good enough. And it's okay to ask for help.
yeah. You know what? I don't think anyone ever has said to be nice to yourself. And that's like, duh, yeah, that's so
But
true. I love
we don't do it. We're so mean to ourselves.
Right. I've probably asked, I think I've asked that question every interview this year. So like 55 probably plus. And I'm shocked that I usually get I think almost, 80% of the time I get a different response. And then I've never heard that one. So yeah, you're right. Be kind to yourself, ladies.
Mhm.
Dr.
Mhm.
Kalyn, tell people how they can get in contact with you.
Yes, so you can check out my Instagram. I am at Pelvic Floor Fitness on Instagram, and then also with Fit. So I work for Fit for Function, and then I have sort of my subcategory of pelvic floor stuff. So we have our Instagram, also the website, fitfortomorrow.com.
All right, awesome. I'll make sure that I put all of that information in the show notes. Thank you so much once again for spending time with me this morning.
Thank you so much for having me. This was awesome.
It really was. Everyone, thank you guys so much for listening. Once again, we here at Hello Hot Flash want to help you control that midlife change. So keep in contact with us, keep on listening, and make sure you're sharing the information with your friends and family. Everyone, here's to your health. Many women hit midlife and suddenly nothing works the way it used to, especially our metabolism. It changes fast, and a lot of programs totally ignore that change. Reverse Health, they're different. It's a science-based program created specifically for women over 40, women who are perimenopausal or postmenopausal, women whose bodies, hormones, and schedules have changed. When you join Reverse Health, you get a personalized plan built around what works now. Smart movement like wall Pilates, strategic fasting, hormone balanced meals, and simple tracking to keep everything realistic. And here's what surprises most women. You don't have to wait months to feel a difference. Many women feel a difference on day one. More energy, more clarity. If you're ready for something designed for your midlife body, visit the link in the show notes to learn more about Reverse Health. Your midlife deserves a program built for you.